Good evening, everyone. Welcome to the George Washington University's 2021 Delta Omega new member induction ceremony. My name is Jennifer Maizel, and I have had the pleasure of serving as the president of Delta Omega at GW's Milken Institute School of Public Health this past year. I am an alumni of GW's MPH program in health promotion, and am currently pursuing my PhD in public health at University of Florida. It is my honor to welcome you to tonight's induction ceremony. Although I wish that we would have been able to host this event in person, I'm so excited that we have the opportunity to do it virtually, especially to see all of our new inductees, as well as your families, friends, and colleagues. Everyone is encouraged to turn on their videos throughout this induction ceremony, especially the new inductees, because we would love to see you. And just in terms of housekeeping items, you will be muted throughout the meeting just so that we can ensure the audio goes smoothly. You are able to chat in the chat box with everyone, and we encourage you to do that. Delta Omega is the National Honorary Society for Public Health. The society was founded in 1924, and it currently includes over 100 chapters across the United States and internationally. GW's Omega chapter was founded in 1995, and we have proudly inducted more than 650 student, faculty, and alumni members since then. Membership in Delta Omega reflects an individual's dedication to leadership and knowledge in public health, with the ultimate goal of protecting and advancing the health of all people. Tonight's induction ceremony is in recognition of your tremendous achievements and leadership potential in public health. This year, we had an exceptional application pool with many more applications than we received last year, and we will be inducting 31 new members tonight. Inductees, I, along with the rest of GW's Delta Omega Executive Board, many of whom are here tonight as well, congratulate you on this prestigious honor and applaud your family, friends, faculty, and other colleagues who have supported you in public health thus far. You are becoming part of a long-standing tradition of recognizing individuals dedicated to advancing public health through scholarship, professionalism, and community service. This past year, we have faced unprecedented public health threats as a result of the COVID-19 pandemic, systemic racism, an overturned economy, a worsening climate, and many other pressing health issues. This has been a mentally, physically, and professionally difficult year for all of us, and I am so humbled by and appreciative of your perseverance and dedication to this field. There has never been a more urgent time for trained public health leaders, and I truly believe that everyone being inducted this evening is going to and has already made significant contributions that will strengthen public health. As someone who was inducted into Delta Omega 3 years ago myself, I wanted to share some advice as we start out this induction ceremony. I highly recommend that you take advantage of this organization and get involved in any way that you can. Joining Delta Omega and serving on the Delta Omega Executive Board for the past 3 years has enabled me to expand my network of public health colleagues and friends, and it has influenced my career trajectory by inspiring me to pursue a doctoral degree in public health. There are many opportunities for you to get involved with our chapter and other Delta Omega chapters across the country, and you'll get to hear more about these opportunities from our incoming Vice President later in this event. This past year, our Delta Omega chapter has focused primarily on addressing health equity and promoting career development for individuals in various public health disciplines. We look forward to building on these initiatives over the coming year, and especially having your participation moving forward. Now it is my pleasure to introduce our first speaker of the evening and fellow Delta Omega member of the Alpha chapter, the Michael and Lori Milken Dean of the GW Milken Institute School of Public Health, Dr. Lynn Goldman. Before joining the Milken Institute School of Public Health in 2010, Dr. Goldman was a professor of environmental health sciences at Johns Hopkins University Bloomberg School of Public Health. Prior to that, Dr. Goldman served as assistant administrator for the EPA's Office of Chemical Safety and Pollution Prevention. She also worked at the California Department of Health, where she headed the Division of Environmental and Occupational Disease Control. She's a pediatrician and environmental epidemiologist who has had a distinguished career in environmental public health and academia. She holds a Bachelor of Science in Conservation of Natural Resources and a Master of Science in Health and Medical Science from the University of California, Berkeley, a Master of Public Health from the Johns Hopkins University, Doctor of Medicine from University of California, San Francisco, and pediatric training from Benioff Children's Hospital in Oakland, California. She's also a member of the National Academy of Medicine. Thanks so much for joining us, Dr. Goldman.
Thank you so much, Jennifer. I'm grateful for your leadership this year as the president of the Omega chapter. And good evening, everyone. It's a pleasure to be gathered with all of you. As I look around the Zoom room, I see an amazing group of students, faculty, and others who comprise this community, and it's a privilege to be a part of this community. Congratulations, especially to our alumni and graduating students who are being inducted into the prestigious organization today. To all of the family members and friends joining us, thank you for supporting these exceptional public health professionals in their work and studies. It is wonderful to be joined tonight by Dr. Adnan Haider, Senior Associate Dean of Research and Professor of Global Health. Adnan, thank you for your leadership as the faculty sponsor of the Omega chapter this year. It is also a pleasure to see Dr. Richard Southby, Dean Emeritus of the School of Public Health and member of my Dean's Council. Richard, thank you for your leadership as well as your wise advice and your support of our school, which has been continuous. Thank you so much. Further, I would like to thank Dr. Dante Verme, Professor of Epidemiology and former Vice Chair of Educational Activities for the Department of formerly Epidemiology and Biostatistics and then Epidemiology. He is tonight's keynote speaker, and I look forward to your comments tonight, Dante. I always enjoy hearing you speak. Additionally, I am so pleased that tonight our honorary inductee is Dean Natasha Kazeem. Dean Kazeem is an incredible leader and a stalwart supporter of the school. During this past year, she has gone above and beyond the call of duty in her efforts to ensure the health and safety of our community, as well as to initiate and to lead very important conversations about diversity, equity, and inclusion. I can't think of another year when these issues have been so critical to all of us in public health and in fact to our entire society. And Natasha has proven herself to be somebody who really rises to the challenge of leadership when that opportunity presents itself. Thank you for that, Natasha. I can't think of a more deserving honorary inductee, and I'm so grateful to the Delta Omega board for nominating and selecting her. We will further celebrate our public health community, especially 2021 graduates, at a virtual commencement ceremony, which will be streamed on Facebook Live starting at 5 p.m. tomorrow, May 13th. I hope you all will be able to join us for that. In this turbulent time, I'm finding great hope in the public health community. Public health professionals have been at the forefront of the fight against COVID-19 in vaccine production and distribution, at testing sites, contact tracing desks, and public education forums. Very importantly, public health professionals have been informing policy. They have been advocating for the healthcare workforce and the protection of vulnerable populations, those who either because of their work, they're essential frontline workers, or because of the health disparities that they experience, even those who have experienced during this time of COVID, violence at home, they have experienced food insufficiency at home as a result of this pandemic. And those who have had very complicated health conditions, some of which have been pre-existing COVID, some have been exacerbated by COVID, some that have been created as a result of COVID. During this global pandemic, we have relied on public health more than ever, and we need to continue to excel in this work in order to keep people as healthy and safe as possible as we press forward in continuing to address this threat. You know, even as things become better in this country, we're opening up Washington, D.C. over the next few weeks. We cannot forget the enormous toll of lives lost that are happening as we speak across the world. COVID has not been defeated, and we can't sit here in our comfort of our homes and our School of Public Health without being aware that we have a tremendous public health challenge that continues to need to be addressed, and that in fact our graduates will be helping to address. As everybody knows, membership in Delta Omega requires academic excellence as well as leadership in community and professional activities within the field of public health. We all know what academic excellence means. It requires hard work, commitment, and rigorous study. You have all done that very well, but it cannot stop here. Excellence in public health means a lifetime of dedication to learning. We don't stop learning. And I think if the last year didn't illustrate why that's the case, we'll never learn that lesson. There's no textbook of COVID-19. We have had to learn continuously in order to be smart enough to address this pandemic. And that is the story in public health. We are always learning. Your curiosity, your quest for good data, your thirst for the best health and safety, your compassion, but also your ability to ask the right questions. We're not giving you the answers to all the questions because we don't even know what the questions in the future are going to be for which you will need answers. But we hope that we are leaving GW with the ability to ask the right questions and the tools to discover the answers to those questions. Wherever your career takes you, no matter your title or position, your rank, please don't stop learning and seeking the best information. Continue to be curious, questioning, and evidence-based in all of your professional pursuits. Being inducted into Delta Omega is a momentous step along your path of excellence in public health leadership. I can't be prouder of all of you, and I'm eager to see the impact that you will make in this world. Congratulations.
Thanks so much, Dr. Goldman, for your inspiring remarks. We are so appreciative of your leadership, especially during this challenging time. Next, it is my pleasure to introduce our keynote speaker of the evening, Dr. Dante Verme. Dr. Verme is a professor in the Department of Epidemiology at the GW Milken Institute School of Public Health. Professor Verme's areas of expertise are geographic information systems, SAS, and R programming. An outstanding teacher whose abilities have several times been recognized with the School's Excellence in Teaching Award. Dr. Verme works with Master of Public Health students on their culminating experience projects, and he guides doctoral candidates in epidemiology and biostatistics on their theses. He has served as a reader on various dissertation research committees, and he has offered training courses in biostatistics in South America, specifically in Argentina and Ecuador, and in geographic information systems in Africa, in Namibia and Tanzania. Dr. Verme has been a faculty in the School of Public Health since it was chartered in 1997, and he was also inducted into Delta Omega here at GW in June of that year. We are so honored to have you here with us today, Dr. Verme.
Thank you very much. Dean Goldman, Dean Emeritus Southby, Associate Dean Hyder, colleagues, incoming class of Delta Omega and friends. Thank you very much for this opportunity. I am very honored to have been selected as a keynote speaker for the incoming class, to celebrate the incoming class of Delta Omega. I express my heartiest congratulations to all of you. You have reached what I consider to be the beginning of a new path in your public health career. You are going to be inducted in what I consider to be the Public Health Hall of Fame. But this is the beginning. We need to make contributions, and you have been trained to make contributions in public health. It is worth noting that you have achieved these accomplishments in the most challenging environment that we have experienced in a generation. The pandemic, plus all the surrounding effects that the pandemic has carried on, has made us think, apply, rethink, and move forward, which is very important. As I was preparing my remarks, I thought appropriate just to quote a couple of sentences from the Milken mission. So what is the mission of Milken School of Public Health? To provide the best public health educational experiences, where we incorporate all the values of public health, excellence. Then we end the vision by saying that we aspire to become one of the top 5 private schools of public health in the world, aspiration. And I want you to keep in mind this, excellence, aspiration, never conformity. We reach a milestone, We move forward. We accept challenges. We don't avoid challenges. And challenges will come, and we've had many challenges this past year. Centerpiece of what has transpired this past year has been COVID-19. It has affected all our lives. And the return to normalcy, where we don't know what normalcy is going to be, still needs time. It's going to face new challenges, and it's going to take the effort of all of us. Although we have made a turn for the best in terms of controlling the pandemic, there's still a lot of work to do. I'm sure all of you remember the day that the WHO declared COVID-19 a pandemic. In fact, I have to go back into my books and find out what is a pandemic. We've dealt with epidemics. I have not dealt with pandemics. And that was in March of 2020 when WHO declared COVID-19 a pandemic. Initially, when it first appeared in China, these cases of pneumonia that had unknown etiology, most of us dusted off. Well, this is going to pass through and we don't have to worry about this. And then all of a sudden it hit us. And it hit us in ways that we were never prepared for. However, we adjusted to it. We made changes to it. We adjusted our lives. And you can think about all the different activities that we used to do that were transformed because of the pandemic. Face masks became a norm of our wardrobe. Social distancing. We heard social distancing over and over again. Spread. Then what became an epidemic achievement was flattening the curve. And we look forward. When would we flatten the curve? Flatten the curve, we were expecting that in one of these presentations that we got from the public health community, we'll see a horizontal line, it flattened. All of a sudden, we continue to see increases in the cases of pandemia and records of negative outcomes, deaths. And we don't want to hear those negative outcomes. We have new cases arising. We have mitigation efforts in place, but death continued to occur. So I'm going to give you some information for you to think about it, and then think what this pandemic has opened that we need to address, which are very important topics for us to address in terms of health inequities and how this pandemic has disproportionately affected minority populations. Okay? Yesterday, the Red Cross has announced that COVID cases in Asia and the Pacific are exploding, with more than close to 6 million new cases in the past 2 weeks. In India, the number of new infections has doubled, more than 23 million cases in 2 months. Worldwide, there are more than 159 million cases with 3,300,000 deaths. Close to 96 million infected cases have recovered. In the US, we have 33 million cases, around 33 million cases, of which 582,000 deaths, case fatality, 177 per 100,000. We have conducted more than 446 million tests, and 266 million are vaccinated, with 117 million being fully vaccinated. So now we are at a point where in the US, we have fewer than 40,000 cases per day, and the number of deaths are less than 600 daily. We would like that to be zero. We don't want anybody to die. In India, we have 23 million cases, 248,000 deaths. In Brazil, which is the country in South America that leads the pandemic, there are 15 million cases with 425,000 deaths. This pandemic, if we drill down the pandemic, you can see that it has affected disproportionately minority populations. And it has highlighted the need to address, now more important than ever, health inequities. So let me give you some information so you can put together what we meant by disproportionately affecting minority populations in terms of the US. People of color are more likely to live in crowded conditions, to work in service jobs that put them in close proximity to others, to have to go to work because they can't afford to miss it, take public transportation, and to lack access to protective gear at work. We also have the issue of air pollution, which according to a recent Harvard Chan School study is linked with increased risk of death from COVID-19. So if we think about what I've mentioned about these disproportionately affected minority populations, if you compare the case fatality rates between ethnic groups, in African Americans and Hispanics, as well as American Indians, they all have at the very least twice or 3 times higher hospitalization rates than the white population. So minority populations have a higher hospitalization rates. In addition, in most cases, they more than doubled the mortality rate. So the mortality rate among African Americans is close to twice the mortality rate of a white population. And it's more than double in the Hispanic or Latino population. So we talk about health disparities and how it has, this pandemic has disproportionately affected minority populations. You can take a look at these statistics. And rather than taking the raw number, we drill down. And now we evaluate this in terms of the ethnicity. Just one additional statistics. In terms of income, where the median income in counties in the US was 60,000 and above, the COVID-19 death rate was more than 9 times higher when compared to counties that are substantially white. This is in minority populations. Keep this in mind. So what is health inequities? What do we have determinants of health that predispose these health inequities? You have discrimination, healthcare access and use, occupation, educational income, housing. So all these different factors, they are disbalances. These disproportionately affect minority populations and predispose them to higher risks for COVID. So those are needs to be addressed. So in sum, we have taken on the most challenging public health pandemic in a generation. We have affronted it. We are trying to solve it. We are getting there. You can see the tireless efforts at the Milken level, spearheaded by Dean Goldman, faculty involvement, students involvement, staff involvement, Natasha Kazeem leading her task force on diversity, equity, and inclusion. High marks for all the effort that have been conducted throughout all this time that we have only seen each other via Zoom. So we adjusted to that, the new reality. So in my closing remarks, I want to go back to what we mentioned before about Milken School of Public Health mission. We are aspiration. We thrive of excellence. We expect excellence, and you will deliver excellence. Don't stop here. This is the beginning of what I consider to be a very productive, self-fulfilling career in public health. Thank you very much. God bless you all.
Thanks so much, Dr. Verme, for your inspiring remarks. It is so great to hear from someone who has advanced the profession of public health as much as you have and continue to do, especially during this pandemic. We have come to the the most fun part of the program where we get to celebrate and induct our amazing public health students, alumni, and faculty into our Delta Omega Honor Society. When this induction ceremony happens in person in past years, we've read each inductee's name and biography as they walk up to the front of the room to receive their induction certificate and a graduation cord. Due to our virtual format this year, many of our student and alumni inductees have submitted videos of themselves so we can hear from everyone about who they are, what program they're graduating from, and what their career paths are going to be in public health. So we'll play this video for you now, and I hope you enjoy getting to see and hear from your new Delta Omega colleagues.
Hi everyone, my name is Ashley and I am a Master of Health Administration student. Following GW, I will be working at Emerson Hospital in Concord, Massachusetts as an administrative fellow. I'm really excited to be joining Delta Omega because I'll be joining a community that is just as passionate and cares about public health as much as I do, and I'm just really looking forward to that.
Hi everyone, my name is Abigail Barth. I studied health policy here at GW, and after graduation, I'll be moving home to New York City and hoping to work at the intersection of research, program, and policy, hopefully in the community-oriented and social determinative health spaces. And I'm really excited to be joining Delta Omega, to be a part of a community of people who are really excited and inspired and passionate about making a difference in public health. And I think there's a lot that I can learn from members of the community.
Hi everyone, my name is Milena Berhane. I currently study health policy, and after graduation, I will be working as a policy research associate at the Sumner Redstone Global Center for Prevention and Wellness in Washington, D.C. And I'm very excited to be joining Delta Omega and this amazing network of public health professionals who are dedicated to improving the health of others.
Hi, my name is Christy Brandmore, and my MPH concentration is Global Health Program Design, Monitoring, and Evaluation. After graduation this year, I will continue working as a Senior Economic Policy Analyst at the American College of Radiology. I'm excited to join like-minded public health professionals and work together towards the advancement of public health, especially during this global pandemic.
Hi everyone, I'm Alex Campione, and I've studied epidemiology during my MPH program here at GW. And I am getting ready to move to Boston and hope to continue doing HIV research. And I look forward to meeting all of you guys and learning what you're passionate about.
Hi, my name is Audrey Cabrio. I'm an MPH student in the online program with a focus on program planning and global health. After graduating and finishing classes in June, I plan to join PATH in their global health security team to work on health system strengthening, zoonotic diseases, and AMR. I'm excited to join Delta Omega to be able to connect with other people in public health and learn from those in the field. Thank you.
Hi, my name is Laura Charney, and I graduated in 2020 with my BS in public health and a minor in psychology, and completed my MPH in health promotion in January 2021, both from the Milken Institute School of Public Health. I'm currently working at ICF in the health sciences portfolio, and our work supports public sector clients such as the EPA and HHS. I'm so excited to join Delta Omega in order to meet other passionate public health professionals and continue to volunteer in my community.
Hi, my name is Sana Hafiz, and I am a current first-year student at GW studying public health. I'm really excited to be joining Delta Omega to meet others in the public health field, become exposed to public health opportunities, and attend seminars and learn more about the field of public health.
Hello, I am Essence Howell, Master of Health Administration candidate. I currently work as an executive assistant, but will continue to pursue roles in health administration following graduation. I'm so excited to be joining Delta Omega simply because the society is filled with dedicated leaders who are committed to serving their communities, increasing quality, and protecting the advancement of health for all people.
Hi, my name is Susie Johnson, and I will be graduating with my MPH in Maternal and Child Health this December. I am currently the Education and Marketing Manager at the National Capital Poison Center, and I'm so excited to join Delta Omega and become a part of this community of other passionate public health professionals.
Hi, my name is Nikki Kanthady. I have an MPH in Health Policy from GW. I have a background in consulting supporting federal and civilian health agencies such as CMS through program oversight, but currently I'm working as a case investigator with the Virginia Department of Health and working hard to conduct case investigations and contact tracing since the beginning of the COVID-19 pandemic. I'm excited and honored to be inducted as a member into the Delta Omega chapter to further develop my leadership skills and network with other alumni.
Hi, my name is Aman Kapadia. I studied at the School of Public Health to obtain my MPH in Epidemiology. After graduation, I'll be attending medical school at Georgetown University. I'm really excited to be joining Delta Omega to work with other like-minded individuals, striving to advance health equity for neglected communities who deserve their right to lead a healthy life.
Hi, my name is Sophia Kaptianis. I'm a rising senior at GW studying public health with minors in nutrition sciences and sociocultural anthropology. After graduation, I plan on pursuing a career in health policy. I'm most excited to join Delta Omega so that I can meet people who are just as passionate about public health as I am.
Hello, I'm Paul Katz, and I just graduated from the online program. Being new to the field, I'm currently seeking a policy-related position in or around CMS, or a position to commit myself toward equity studies, whether specifically in healthcare or areas of its social determinants like housing or education. While I'm very proud of the coursework that got me here, I really look forward to having the kind of impact on public health that justifies my membership in Delta Omega. I'm just so honored to be inducted today and to be your colleague. Thank you.
Hi, I'm Melissa Kerwin, a student in the MPH at GW online program. Throughout the program, I've focused on maternal and child health, and after graduation, I plan to continue research in this area. I'm really excited to be a part of Delta Omega for the opportunities to engage with the community and the chance to really bridge the gap between public health research and practice.
Hi everyone, my name is Carrie Kowalik. I'm a junior and I'm pursuing my Bachelor's of Science in Public Health and Organizational Sciences. Currently, I am planning on getting my JD MPH after college, and I'm so excited to join Delta Omega to meet other individuals with my same passions. Thanks.
Hi there, my name is Deletta Matone and I'm currently completing my MPH in Maternal and Child Health at GW. As I'm completing my studies, I'm also working full-time at Mathematical Policy Research as a research associate working on implementation and evaluation of programs in the areas of early childhood, education, child welfare, and family support. I'm really excited to be joining Delta Omega because of the network of public health professionals that I'll be joining that are just as passionate about the field as I am, so I'm looking forward to it.
My name is Lauren Nath. I'm graduating with an MPH in Health Policy this spring. After graduation, I will be working at Pyxis Partners, a health policy consulting and advocacy firm based in Washington, D.C. I'm excited to be joining Delta Omega for the opportunity to be a part of a group of people dedicated to improving public health across the country and to be able to continue learning and growing as a leader in the field.
Hi, my name is Sarah Nishijima. I'm in the Masters of Public Health program, and I'm planning to continue my education and find employment. It is a privilege and honor to be a member of Delta Omega, and I plan to be a good ambassador of the values and ethics I was taught here at George Washington University throughout my entire career. Thank you.
Hi, my name is Ajay Prasad, and I will be graduating this year with a Master's in Public Health, specifically concentrating in environmental and occupational health. After graduation, I will be joining NNPHI, the National Network of Public Health Institutes, in their Emergency Preparedness, Response, and Recovery portfolio as a program associate. I'm super excited to join Delta Omega as a new member and to be connected with such amazing and dedicated public health professionals.
Hi, my name is Carly Roberts. I'm studying epidemiology and will be graduating with my MPH later this year. Following graduation, I'm hoping to pursue a career in cancer epidemiology. And I'm really so excited to be joining Delta Omega and be connected with such a great group of public health professionals. Thank you.
Hi, my name is Christy St. Pierre. I just finished the MPH program in Public Health Nutrition. And in the fall, I'm going on to the PhD program in Exercise Physiology and Applied Nutrition here at GW, and I'm really excited about that. I am excited to be joining Delta Omega to get to know others from throughout the public health disciplines, and I look forward to meeting you all.
Wow, congratulations to all of our new student and alumni members. Before we celebrate everyone, next I would like to introduce our 2021 honorary member inductee. Each year, our Delta Omega Chapter's Executive Board has the opportunity to nominate one exceptional individual, whether it's a student, alumni, faculty, or staff member, to be our honorary member. This year, we have selected Dean Natasha Kazeem for this honor. Natasha Kazeem is the Executive Associate Dean of Operations and the Chief Operating Officer for the GW Milken Institute School of Public Health and Chair of the School of Public Health's Diversity and Inclusion Task Force. She provides strategic and administrative leadership towards enhancing services, assuring the most effective use of resources, and positioning the School of Public Health to acquire, allocate, and retain resources needed to sustain programs and advance the school's mission. As the former senior advisor and assistant dean for strategic initiatives, she successfully led several large-scale programs, in particularly the strategic plan and the first school's diversity and inclusion task force. In addition, she has supported the organization in building capacity in the areas of operations, partnerships, philanthropy, teaching, and research. Dean Kazeem has 15 years of experience in higher education, health and healthcare research sectors, human resources management, project management, and diversity and inclusion. She is a graduate of Boston College, a certified business manager of the Wharton School of Business, and she completed her Master of Business Administration at the GW School of Business in 2018. Thanks for all you do, and congratulations on being our honorary member.
Thank you so much, Jennifer. Good evening, Dean Goldman, Dean Southby, Dr. Verme, Dean Hyder, the Delta Omega Executive Board, and new and current members of Delta Omega. I am deeply honored to join Delta Omega this year as this year's honorary member and having a seat at the table of some of the most notable public health warriors of our time, to include all of you. I would like to start with a land acknowledgement, as my home resides on the stolen land of the Piscataway Nation. I want to acknowledge the painful history of genocide and forced removal from this territory, and respect the many diverse Indigenous peoples still connected to lands we gather. I'd like to give a special thanks to my family and friends. This also includes my GW family, who inspire me every day. I recognize that I stand on the shoulders of those who came before me and opened the pathway for this American African Indian who stands before you today. It has been my pleasure to serve the school in a number of capacities. My first language is business and strategy. I am what Robert Greenleaf would call a textbook servant leader. My sense of accomplishment is directly connected with being able to serve others. This is something that was imprinted upon me a long time ago by my late grandmother, who raised me to think beyond not just myself, but also to factor the needs of others in everything I do with grace and humility. In the time that I've been with GW, I've come to realize and accept that while my first language is business, my love language is public health. The community I serve and admire, the faculty, the staff, the students, and alum have given me far more than I've given it. It's the interdisciplinary nature of the work of public health, the altruism, and the grit that it takes to improve the lives of communities that has captivated me. Our public health community has taught me to look for gaps and to raise the visibility around the tough questions confronting our health. With the year that we've all endured, I realized that my service needed to go beyond making sure that the trains were running on time and overseeing the multi-layered support needed to run the operations of the school. Our community was hurting. Our BIPOC community was in pain, grappling with the pandemic, as well as the pandemic within the pandemic. We were all on the front lines of this crisis. Many of us caregivers challenged with keeping ourselves, our families, and our communities safe as the floor continued to shift from right underneath our feet. Boldly stepping forward, APHA declared racism as a public health crisis. With that declaration and the responsibility that was placed on my shoulders as one of the leaders here at the school, the call to action for me was never clearer. We can no longer separate what's happening in the world from our business, because what's happening in the world is in fact our business. If we are going to continue in this fight together to eradicate racism and social injustice, that work starts right here with each and every one of us. What does this look like for me? On a very basic level, every time there's an injustice, you can always count on me to ask the question, what are we going to do about it? With the support of my fantastic team here at the school, we are moving intentionally and creating space and dialogue for our community to help us process, to learn from one another, and to also heal. One of my favorite quotes from Marian Anderson, the famous contralto, who once said, "No matter how big a nation is, it is no stronger than its weakest people. And as long as you keep a person down, some part of you has to be down there to hold them down. So it means you cannot soar as you might otherwise." I look at all of our members today feeling renewed in our commitment to pave the way for BIPOC and all communities to soar. We accept that we may not see the fruits of our labor in our lifetimes, but let's continue our work together to pass the reward forward to the generations that will be coming behind us. I thank you so much for seeing me, for the tremendous honor. And lastly, to our Muslim brothers and sisters, Eid Mubarak. And I also ask that we continue to remember our brothers and sisters in India who need our prayers and support now more than ever. Thank you so much.
Thank you, Dean Kazeem, and congratulations to you and all of our 2021 inductees. I'm so humbled to be surrounded by such an incredible group of public health students, alumni, and faculty. I know we are all on Zoom, but let's try to take a moment to all clap and cheer together. For those who are able to unmute, please unmute and cheer, and for everyone else, please clap so we can see everyone's success. Congratulations to all again. So this past year, it has been my honor to serve as the president of GW's Delta Omega chapter. Now, as we have many new inductees joining our chapter and a new leadership term starting soon, it's my honor to introduce you to our next speaker, who is our incoming Delta Omega chapter vice president, Brenda Trejo, who has served as a member at large of our chapter for the past year and is a doctoral student in environmental and occupational health at GW. She will be speaking on behalf of our incoming president, Meghana Vijayasimha, who is unfortunately unable to attend today's event due to a family emergency, but sends her congratulations to everyone. Thanks, Brenda, for being here and for all you've done.
Thank you, and thank you all. Thank you, everybody. I think this reminds me of why I enjoy being a part of this community, of the public health community, and especially the GW School of Public Health community. And Dean Kazeem, I just learned from her that my love language is public health also. So good evening to everyone. I am Brenda Trejo, and it has been an honor to serve as an officer for Delta Omega this past year. Next year, I have the privilege to serve as your vice president. And serving for Delta Omega has allowed me to continue building and sustaining relationships with incredible SPH professionals, my colleagues, students, professors, staff. This year, we've been able to come together while physically distancing to gain skills on how to communicate about racism, equity, and how to write op-eds for public health advocacy through some of our events. As officers, we also got a glimpse of the involvement of tonight's inductees. All of you are involved in public health research, scholarship, and practice, even throughout this pandemic and even as students. Your leadership has been needed, it is needed, and will continue to be needed. The work that you all engage in is important to achieve health equity for all. Your work brings hope to me, it brings hope to many. As COVID-19 has made undeniable, we are interconnected, and public health that advances hope and equity is here to stay. Thus, we encourage you to share your skills and consider serving as an officer for the Delta Omega chapter. We have open positions and we'll send an invite to you all soon, and we strongly encourage you to apply. Remember that service is not limited to being an officer. We welcome you to attend events, host events, share ideas about events. Each of you have immense talents and expertise that are welcomed. We also encourage current students and alumni, current students to take steps towards applying next year, actually alumni too. So current students and alumni to apply and, strive to become a member of this community. And lastly, remember that we are stronger together. And now I turn it over to Patrick Sanders so he can share how you can engage as an alumni.
Thank you, Brenda, and good evening, everyone. As we prepare to wrap up this evening, I just want to thank everyone again for joining us this evening to celebrate our newest class of Delta Omega chapter members. As the alumni advisor for Delta Omega for the last 5.5 years, it continues to be a pleasure of mine to see this group excel as an organization led by and for our School of Public Health alumni. So kudos to all members of our executive board for your service. On behalf of the Development and Alumni Relations Office, I want to remind all of you, alumni, current students, everyone on this call to stay involved and engaged with our community. As we've seen tonight, it's a really special one. With an alumni network of nearly 300,000 individuals, the GW community stretches across the United States and around the world. As Brenda just mentioned, there are a number of opportunities to become involved with Delta Omega. Additionally, I encourage you to visit alumni.gwu.edu to learn about our regional, affinity, and industry networks. Whether you are looking to expand your professional or social networks, these are great ways to connect with fellow GW alumni. And be sure to stay connected with us and let us know where you moved to and how best to stay in touch with you. We want to ensure you are in the know, not only about our Delta Omega news and events, but also about our GWSPH and GW news and events as well. As the university celebrates its bicentennial this year, you really don't want to miss out on any of the great events and opportunities to engage with us. If you ever have any questions about being engaged with fellow GW alumni, questions about your alumni benefits and services, or want to discuss ways that you can give back to this community, please reach out to me and my team at gwsphalum@gwu.edu. Thank you all so much for joining us this evening, and congratulations again to all of our new inductees. And as we say here at GW, raise high.